Hello, Roger Watson again, and I'm the Editor-in-Chief of Nurse Education in Practice. And in this session, I've been asked to talk about how to publish in Nurse Education in Practice. Well, the first thing about publishing in Nurse Education in Practice is that there are a lot of things that we have in common with every other journal. So many of the things that I've said generally about writing for publication would apply to writing and publishing Nurse Education in Practice. So, for example, reflecting on other videos that I've made in this series, the 4 rules of writing are very important in order to get your writing done, started and completed. The 4 rules being to read the guidelines, and I'll come back to the guidelines in a minute. Read the guidelines, set yourself targets, get some help with your writing, get someone to look at it, and finally treat every rejection as the beginning of the next submission. And you may well be rejected by Nurse Education in Practice. That may well be part of the process. That means you won't be published, but it doesn't mean to say that the work is necessarily bad. It just means to say it's not suitable or maybe not good enough for our journal, but you must press on and try and get your work published somewhere else. So don't take a rejection from us as the end of the road. It's also the case that we will sometimes publish work that's been rejected elsewhere. It's not quite a random process, but it's a process based on decisions made by people. People make different decisions. People sometimes get decisions wrong. So remember the 4 rules, and I think the most important one of those for your academic career is to treat every rejection as the beginning of the next submission. But anyway, back to and everything I've said in previous sessions and some of the things I'm going to say in subsequent sessions in this series applies to publishing in Nurse Education in Practice. Now, the first thing to know about Nurse Education in Practice is that it's now a very well established journal. It was established in 2000, so it's been going at the time of me doing this presentation for over 22 years, coming up to its 23rd year. It's in its 23rd year now. So this means that it's a very well established journal, and it's quite important to realise it's published by the publisher Elsevier. It was designed as a sister journal to the even better established journal Nurse Education in Practice. Nurse Education in Practice was established a very, very long time ago. I'm not sure if anybody knows exactly when it was published, because it arose through different publishers, but I think it might well have been going since certainly the 1980s, if not the 1970s. So it's got a much longer history and it's much better established. The 2 journals even look similar. If you go online, the covers look very similar. One's called Nurse Education Today, the other one's Nurse Education in Practice. Now, the title of the journal gives you some idea of what the journal's about. It's a practice-based journal, or it is supposed to be. So it's about education in practice, or education for practice. However, both editors of both journals, and we do meet and talk quite regularly, and I talk with my editorial team. We do strive at times to try and see how we can differentiate the content of the journal. It's actually quite difficult to do that. And I know for a fact, because I've been involved in papers that I've published in both journals before, I know that I've had papers rejected by Nurse Education in Practice, which I now edit, which have then been published in Nurse Education Today, and I know that many papers that have been rejected from Nurse Education Today subsequently get published in Nurse Education in Practice. So there is a slight distinction between the journal, but there's also an overlap as well, and I wouldn't worry too much about that. Clearly, if you've got something that really is about Nurse Education in Practice, and not nurse education generally, it probably is better to head it towards our journal. And sometimes we will look at papers and say, actually, this really isn't for us. It is about education, but really it might be better for NET, and NET will do the same occasionally. So that's the origin of Nurse Education in Practice. When it started, of course, it had no impact factor. Journals do not start with an impact factor. and around 10 years ago it entered the Clarivate, which was then the Web of Science impact factor list, now run by Clarivate. Nurse Education and Practice had an impact factor for a very long time before that, and in a very short time the impact factor has grown. At the moment the impact factor is over 3, which is very good for a nursing journal, and particularly a nursing academic journal, and very few journals do have an impact factor over 3. So we're very pleased about that, and clearly we want to keep it there. Now, we are not completely driven by impact factor, and I do have certain misgivings about impact factor. However, for us as editors and my publishers, the impact factor is an indication that we're publishing content that is useful to people, that's read and cited. You've got to bear in mind that only a very small section of the papers in a journal are read and cited. About 15% of them contribute towards the impact factor. The impact factor does not tell you anything about the quality of the journal or the quality of the other articles, but it is important to us that we do publish some articles that are read and cited, and we always, of course, are happy to try and increase our impact factor. And so you've got to be aware of that, and that's one good thing to be aware of when you are trying to get published in our journal. We do pay attention to the extent to which our articles are read and cited. So we are looking for articles that are likely to be read and cited. Of course, one of the key types of articles that is read and cited and contributes a great deal to the impact factor is review papers, systematic reviews preferably, but scoping reviews and meta-analysis as well. And we are publishing more of these, and we notice that they do contribute indeed from our latest figures to the impact factor. So I'm not saying that you should only send us systematic reviews. I'm also not saying by any means that all systematic reviews are accepted. Some are rejected. However, you do have a higher chance, certainly, of being put forward to a handling editor, and possibly a slightly higher chance of being published if you send a systematic review. So that's just one way of getting into the journal. I think the most important thing about getting into Nurse Education and Practice, or getting published in Nurse Education and Practice, is not really that about reviews. It's about reading the guidance to the journal, and I cannot tell you how many days in the week, almost every day in the week, 5 days a week, I open my editorial box and I will always have at least one, sometimes several papers that are not relevant to the journal. And this clearly comes from two things: people not reading the guidance or not looking at the journal. And you might detect the passion in my voice. It really annoys me, and it really annoys other editors as well. The journal is about nurse education in practice. Therefore, it is not about clinical care. So I've had papers recently about care pathways for people with dementia. Great paper, no problem at all with the paper. Not suitable for us because there was nothing about education, nothing about education in practice. We get clinical trials submitted to us, sometimes by medical practitioners. Absolutely not suitable for our journal at all. They just get rejected as being out of scope. If you're very, very lucky, and I really take to the paper for some other reason, I may recommend that it is considered for another journal within the Elsevier stable, and somebody will handle that and ask you about that. But usually we haven't got time to do that, so the paper will just be rejected. So if you submit an article to Nurse Education in Practice, which is not about nurse education in practice, or at least about nurse education, it will just be rejected. You've wasted your time. You've also wasted my time as well. So how to get published is mainly based on reading the guidelines. Now, again, I've talked about several things to do with publishing generally. I'm going to talk about a few things in subsequent videos, all of which are important to getting published in Nurse Education Practice. So we are a mainstream, international, we consider ourselves to be a high quality, refereed academic journal. So we expect the standards of writing, the standards of work that's being reported to be the best and to be suitable for the journal. So that's an important thing to realise. Just because we're a nurse education journal doesn't mean to say we're easier to get into, and because it's nurse education and practice, we're not some small niche journal. The journal is growing all the time. So we're looking for the best papers. So in order to get published, you have to write the best papers for us. So our rejection rate is very high. It's very, very high indeed. I don't want to give an exact figure, but I would reckon that we only publish about 20%, less than 20% actually, of the articles that are submitted to us. So a huge swathe of articles are rejected by me as soon as they arrive on my desk or as soon as they arrive on my inbox, and then a subsequent swathe of articles is rejected by the editors, and even of the ones that go into review, some of them get rejected too. Our objective is to put papers into the review system that are likely to be accepted. We don't want to sort of waste our time with papers that are not going to be accepted. So I've said it 3 times I think already. I'll say it again. Read the guidelines. Read them very carefully. We adhere to all the international standards of publication, like the Equator Guidelines, which I'm going to speak about in a subsequent video. We adhere to the Committee on Publication Ethics, which I'm going to talk about in a subsequent journal. So our quality indicators for publication, our ethical standards are of the highest and comparable with any other journal on the Clarivate list. So we try to publish papers which are presented according to international standards for different types of studies, and we are always on the lookout for plagiarism or duplication or any transgression of ethics which may preclude the paper from being published or may get you in trouble afterwards. When I said earlier that we don't publish clinical work, not strictly true. We will publish studies which are about clinical education, which have led to changes in patient care. But if patient data are being collected, the study absolutely, in accordance with World Health Organization guidance, must be registered. If it's a clinical trial, and we do have clinical trials of different interventions with patient outcomes, it has to be registered on a clinical trial registry. If it's not, then the paper will be rejected immediately and it will not be recommended for publication anywhere else. You cannot publish papers with patient data in them without registration, and if they're a clinical trial, they have to be on a clinical trials registry. That's quite a common way for papers to be rejected. That said, we do have papers which conform. If there is any other patient data in the study, then you should register it with some other site, such as the Open Science Foundation, which is free to use. Where patient data are concerned, studies have to be registered. You have to be accountable. The protocol has to be available beforehand, and the study has to be traceable and followed up in case something goes wrong. So where patients are concerned, only in a very few studies, we conform to the same international standards as all other studies would under the WHO, World Health Organization guidance. I can't think of really anything else to say about getting published in nurse education and practice, other than what I've said already, just to recognise that we are a sister journal to NET. We publish very similar content, perhaps a slight differentiation between the two. We're an impact factor journal, and we pay attention, of course, to the citations of articles, so we want to publish articles which are likely to be cited. We do want the best studies that we can get. Some of the studies that I would say we don't want, just before I finish, we don't want before and after studies, within subject studies where a perfectly good comparative study could have been done. We get far too many of these. We don't really want evaluations of educational interventions. We want proper research. And I plead, we do not want any more studies on COVID-19 and the influence it had on nursing students' education. We have dozens of these and they all say the same thing. We have published some in the early days and they did very well, but the COVID situation is finished and there's nothing really new to say about it. So I thought I'd just mention that at the end. So that's how to get published in Nurse Education and Practice. There are no guarantees that you'll get published, but if you follow some of the guidance that I've given you, you increase your chances. So I hope you found that useful. I hope you will try publishing in Nurse Education and Practice. And once again, thank you very much for listening.